On June 22, 2001, the United States government began Operation Dark Winter. Operation Dark Winter was not a war game. Instead, it was something more unusual. Dark Winter was a germ game. In 2001, the US military, government, and media launched a mock battle against pathology. The premise was simple. A bioterror organization released a deadly virus into the country, and smallpox is spreading quickly. The US government must now react to contain the outbreak and stop further harm. How did we do? The results were disastrous. Within 48 hours, the government failed its objectives. The loss of human life was high, and when Operation Dark Winter ended 3 days later, a summary of recommendations were given to implement across different levels of government to better prepare in case of a future dark winter.
Percent of Americans say they would definitely agree to take a coronavirus vaccine if it was approved by the government. What steps would you take to give Americans confidence in a vaccine if it were approved?
Make sure it's totally transparent. Have the scientists of the world see it, know it, look at it, go through all the processes. And by the way, this is the same fellow who told you this is going to end by Easter last time. This is the same fellow who told you that, don't worry, we're going to end this by the summer. We're about to go into a dark winter. And he has no clear plan, and there's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.
President Trump, your reaction, he says you have no plan.
We're going to have a dark winter.
Joe Biden is promising a long, dark, painful winter. Did you see him at the debate? Did anybody see the debate by any chance? No, he said long, dark winter. Oh, that's great. That's wonderful. That's just what our country needs, is a long, dark winter and a leader that talks about it.
Good morning, Doug. The head of the CDC is warning that a dark winter is looming, saying
there's a need for bold action to fight this pandemic. We're still facing a very dark winter. Before the surge in COVID cases many predicted, and the deaths rise that we've seen in December, as we head into a very dark winter ahead.
On a Chamber of Commerce day in Houston, people enjoyed the bright, sunny skies, just weeks ahead of what one doctor says most epidemiologists are predicting will be
what we have been calling a dark winter.
The head of the CDC is warning Americans of a dark winter ahead for the coronavirus pandemic.
The reality, we are facing a very dark winter. The news about the...
You said President-elect Biden is charging ahead, promising a bold new strategy to fight the virus, but warning of a dark winter. Mary Bruce has the latest. Good morning, Mary.
So for us, it could be a long, dark winter in Dodge County.
Britain is braced for a dark winter as new measures are deployed to stem a surge of coronavirus.
Their morale is low. Funding is going to help through this dark winter we're about to have.
Morning. Thank you so much for joining us.
Thank you so much for having me.
And we've heard the term dark winter in relation to mental health. What exactly does that mean?
Sure. So dark winter is actually referring to seasonal affective disorder, which is a mood disorder that people usually get affected by in the winter months. And people are going to be, unfortunately, more affected by it this winter because COVID-19 is robbing people of their usual ability to cope and the things that they might normally do to help themselves cope with seasonal affective disorder and now dark winter.
I said in March it was going to be a long, dark winter. We're still in that long, dark winter.
Susan Elizabeth.
We are headed for a very dark winter.
Operation Dark Winter was the code name for a senior-level bioterrorist attack simulation conducted from June 22, 23, 2001. It was designed to carry out a mock version of a cover and widespread smallpox attack on the United States. Tara O'Toole and Thomas Inglesby of the Johns Hopkins Center for Civilian Biodefense Strategies / Center for Strategic and International Studies, and Randy Larson and Mark Demio of Analytic Services were the principal designers, authors, and controllers of the Dark Winter project. Dark Winter was focused on evaluating the inadequacies of a national emergency response during the use of a biological weapon against the American populace. The exercise was solely intended to establish preventive measures and response strategies by increasing governmental and public awareness of the magnitude and potential of such a threat posed by biological weapons. Dark Winter's simulated scenario involved an initial localized smallpox attack on Oklahoma City, Oklahoma, with additional smallpox attack cases in Georgia and Pennsylvania. The simulation was then designed to spiral out of control. This would create a contingency in which the National Security Council struggles to determine both the origin of the attack as well as deal with containing the spreading virus. By not being able to keep pace with the disease's rate of spread, a new catastrophic contingency emerges in which massive civilian casualties would overwhelm America's emergency response capabilities. The disastrous contingencies that would result in the massive loss of civilian life were used to exploit the weaknesses of the U.S. healthcare infrastructure and its inability to handle such a threat. The contingencies were also meant to address the widespread panic that would emerge and which would result in mass social breakdown and mob violence. Exploits would also include the many difficulties that the media would face when providing American citizens with the necessary information regarding safety procedures. Summary of findings: according to UPMC's Center for Health Security, Dark Winter outlined several key findings with respect to the United States healthcare system's ability to respond to a localized bioterrorism event. An attack on the United States with biological weapons could threaten vital national security interests. In addition to the possibility of massive civilian casualties, Dark Winter outlined the possible breakdown in essential institutions, resulting in a loss of confidence in government, followed by civil disorder, and a violation of democratic processes by authorities attempting to restore order. Shortages of vaccines and other drugs affected the response available to contain the epidemic, as well as the ability of political leaders to offer reassurance to the American people. This led to great public anxiety and flight by people desperate to get vaccinated, and it had a significant effect on the decisions taken by political. In addition, Dark Winter revealed that a catastrophic biowarfare event in the United States would lead to considerably reduced U.S. strategic flexibility abroad. Current organizational structures and capabilities are not well suited for the management of a biowarfare attack. Dark Winter revealed that major fault lines exist between different levels of government, between government and the private sector, among different institutions and agencies, and within the public and private sector. Leaders are unfamiliar with the character of bioterrorist attacks, available policy options, and their consequences. Federal and state priorities may be unclear, differ, or conflict. Authorities may be uncertain, and constitutional issues may arise. For example, state leaders wanted control of decisions regarding the imposition of disease containment measures, the closure of state borders to all traffic and transportation, and when or whether to close airports. Federal officials, on the other hand, argued that such issues were best decided on a national basis to ensure consistency and to give the president maximum control of military and public safety assets. Leaders in states most affected by smallpox wanted immediate access to smallpox vaccine for all citizens of their states, but the federal government had to balance these requests against military and other national priorities. State leaders were opposed to federalizing the National Guard, which they were relying on to support logistical and public supply needs, while a number of federal leaders argued that the National Guard should be federalized. There is no surge capability in the U.S. healthcare and public health systems, or in the pharmaceutical and vaccine industries. The exercise was designed to simulate a sudden and unexpected biowarfare event for which the United States healthcare system was unprepared. In the absence of sufficient preparation, Dark Winter revealed that the lack of sufficient vaccine or drugs to prevent the spread of disease severely limited management options. Due to the institutionally limited surge capacity of the American healthcare system, hospitals quickly became overwhelmed and rendered effectively inoperable by the sudden and continued influx of new cases, exacerbated by patients with common illnesses who feared they might have smallpox, and people who were otherwise healthy, but concerned about their possible exposure. The challenges of making correct diagnoses and rationing scarce resources, combined with shortages of healthcare staff, who were themselves worried about becoming infected or bringing infection home to their families, imposed a huge burden on the healthcare system. The simulation also noted that while demand was highest in cities and states that had been directly attacked, by the time victims became symptomatic, they were geographically dispersed, with some having traveled far from the original attack site. The simulation also found that without sufficient surge capability, public health agencies' analysis of the scope, source and progress of the epidemic was greatly impeded, as was their ability to educate and reassure the public, and their capacity to limit casualties in the spread of disease. For example, even after the smallpox attack was recognized, decision-makers were confronted with many uncertainties and wanted information that was not immediately available. Without accurate and timely information, participants found it difficult to quickly identify the locations of the original attacks. To immediately predict the likely size of the epidemic on the basis of initial cases. To know how many people were exposed. To find out how many were hospitalized and where. Or to keep track of how many had been vaccinated. Dealing with the media will be a major immediate challenge for all levels of government. Dark Winter revealed that information management and communication will be a critical element in crisis consequence management. For example, participants worried that it would not be possible to forcibly impose vaccination or travel restrictions on large groups of the population without their general cooperation. To gain that cooperation, the President and other leaders in Dark Winter recognized the importance of persuading their constituents that there was fairness in the distribution of vaccine and other scarce resources, that the disease containment measures were for the general good of society, that all possible measures were being taken to prevent the further spread of the disease, and that the government remained firmly in control despite the expanding epidemic. Should a contagious bioweapon pathogen be used, containing the spread of disease will present significant ethical, political, cultural, operational, and legal challenges. In Dark Winter, some members advised the imposition of geographic quarantines around affected areas, but the implications of these measures were not clearly understood at first. In the end, it is not clear whether such draconian measures would have led to a more effective interruption of disease spread. What's more, allocation of scarce resources necessitated some degree of rationing, creating conflict and significant debate between participants representing competing interests. Key participants. In popular culture, Tom Clancy's The Division, a video game inspired by Dark Winter. See also, 2001 anthrax attacks. References. External links, Operation Dark Winter, shining light on a OE Dark Winter or a local response to a national threat, preventing a OE Dark Winter or a CNN, Dark Winter and lack of USA preparedness, Dark Winter teaches bioterror lessons, Dark Winter at Sourcewatch.
Sickness, breed shadows that lurk in hearts, sail, they tear and bleed, Dark Winter perseveres, voices screaming together as one, we won't take bended knee, Dark Winter perseveres, and so do we. Contagion burdens our humanity, where children used to play, now violence flares, their futures crushed and quarantined. Scattered, we all know what it takes to weather through the cold. 'Cause if we fall, we forfeit too much that's at stake. Hold on, hold on, hold on. The ice will melt, the sun will come. Sickness, breed shadows that lurk in hearts, sail, they tear and bleed. Dark Winter perseveres, voices screaming together as one, we won't take bended knee. Dark Winter perseveres, and so do we. Lives are lost, hearts displaced, and no one knows how many we can save. Far off from home, frozen still, but one day we will outgrow breakthrough. Sickness, breed shadows that lurk in hearts, sail, they tear and bleed. Dark Winter
The dark winter came after the first pandemic, and while everybody was paralyzed from fear of the virus, we had something far greater that we were unprepared for. Cyber Polygon was the largest cyber attack ever to be executed. The world's internet was collapsed intentionally, and all of our rights to information were cut off. Banking, medical records, all databases were heavily attacked. Power grids were shut down, businesses were finished. Economies collapsed, forcing us closer and closer to the Great Reset. Most were not prepared for this annihilation, and were now frozen within the illusion of democracy. The puppets performed on stage, while we watched impassively. We had entered the dark winter without any awareness. When the attack finally came, it moved at lightning speed. The military were brought in to keep order on the streets, to assist the understaffed police. With the huge cut in funding, institutions broke down, resulting in a worldwide loss of confidence in government. People fought amongst themselves, and countries were close to a civil war. Many people died due to the civil unrest, and the casualties were out of control. The world was in a state of international emergency.
You had to fight for yourself over those years. Economies had fallen, and unless you were self-sufficient, obtaining food was difficult. People had relied so much on the old system that when the rug was pulled from under our feet, we didn't realize what had happened. We were not prepared for those months. They had brought the attack forward as the few of us who had awoken started to reveal the mechanics to this evil. The algorithms inside the control rooms had told them that they had to attack us now. People's stupidity and denial of truth kept the majority running in the gerbil wheel. Most just fell into an even deeper sleep. We had fully immersed ourselves into their narrative, digesting and living the script they had planned for a very long time. So many just blindly followed, lost in a heavy, suffocating, all-encompassing darkness. They created the money, they created the problems. They then created a solution that only limited us further. They used the excuse that the money isn't available to solve those problems, so we ended up caught in a whirlwind of dramas that stifled our human evolution. The creators of that money wanted control of our consciousness, and they would do everything to stop us. No one was going to save us from this horror. No leader could sufficiently lead us. We were emerging slowly, but would we change in time? We could only lead ourselves, but most people had been broken down by the constant abuse of control. We had to come together and find ways to connect, but most locked their houses and kept themselves barricaded in. The ones that were trapped in the cycle of fear were the ones that perished. When we stood strong, understanding our true power, this could not affect us. Your life is your human sovereignty. Each life is crucial. Each life must be questioned. When do you give your power away? Where do you feel powerless?